3.
Hi, this is your Houston chiropractor, Dr. Tristan Wendt, and today I've got Frank back in the office. Frank is a return patient of ours coming in for his second treatment today. And Frank, I want you to tell the crack addicts out there a little bit about how your first visit was here at Advanced Chiropractic Relief.
My first visit was awesome. I'd never been adjusted like that before. I've been going to a chiropractor since I was 18. It was definitely life-changing. I'm more mobile now. It was really, really good.
Awesome. You know, I wasn't lying to you when I said you might be a little bit sore after that first visit, though. Frank said he was sore for probably, what, about 2 days afterwards?
About 2 or 3 days on my problem area, and since it went away, I haven't had any issues. So
and you've noticed a lot of changes in your golf game, too, recently, huh?
Yeah, I can actually turn and hit the ball further now. So
you're having to change up the golf game now that we've got more range of motion.
Exactly.
There, huh? So let's show you the crack addicts out there how we got that work done for you, Frank.
All right.
So we're going to get you on the ring dinger table first today. We're going to butt here, head up this way. And Frank actually came in wanting to do a video with us today, and a lot of people think that we're just doing videos on every single patient that walks in, but patients actually need to ask us if they want to do videos and actually show the audience their care. I think there were some people that were wanting to see your ring dinger and make sure your head was attached after the second visit, huh?
Yep.
And if you want to give a shout out to any of those people, you're more than welcome to. Some of you scoot down just a touch for me, Frank. Perfect. There we go. Had a little bit of change fall out of your pocket there.
Yeah.
Don't worry, we'll pick that up at the end of the visit here. We don't take tips less than 100, so. So just a reminder for this one, I want you to keep those teeth together for me. I don't need you to clench them, just touch them so that tongue doesn't get between there. One more nice big breath in through that nose for me. And then all the way out. Boy, oh boy.
That was a lot better than the last time.
Yeah, a lot smoother this time.
Yep.
You didn't scream nearly as loud as that first one, huh?
Right?
Yeah, Frank wasn't a drama queen on his first visit. It was just intense, huh?
Yeah, very.
You'll notice that the second visit and third visits, they get less intense, but you actually get more of that decompression sensation because we're tearing loose a lot of that scar tissue between those joints now. Go up the right-hand side here first. Nice. I'll go on this left-hand side. And I want you to kind of drop this right ear into my hand on this side there. Oh boy. That'll wake you up better than a cup of coffee one morning, huh?
Definitely.
No better way to start your day than with a ring dinger.
Yes, sir.
Oh, look at that. Your head's still attached. You're still walking, talking, breathing. Having a good time in here.
Oh, yeah.
Next, we're having you go face down here. Last time we got a little bit of movement through Frank's mid-thoracic spine, but now that we've got him decompressed twice, I'd expect to get a little bit more movement there. Now that we've got some of the compression taken off of those joints and discs in his upper thoracics. We're still about 1/8 of an inch short on the right. Not nearly as bad as that first visit when you came in. Gets even. It's just a touch longer there at the end. Does that tighten up a little bit in that low back, Frank?
Just a little bit.
Not nearly as much as last week, huh?
No, not even close.
One of the beautiful things about this practice too, and something that Dr. Johnson's always trained to me, is that we do not accept patients unless we think that we can actually benefit and help those patients that are coming into our office. So Frank, I wouldn't have even accepted you as a patient if I didn't think the issues that you were dealing with were something that we could handle in this office, which is another thing that I really appreciated about what Dr. Johnson taught me as a young chiropractor. So next I'm gonna start right here at L5, and these might be still a little bit tender like last time, but not nearly as much as that first visit when you came in. Good. Last one here, deep breath for me in through that nose. Good. I'm gonna loosen up a few of these tight muscles here for you too, real quick, Frank. Like I told you last time, I'm never gonna let you leave the office without being a pain in the butt first. So has golf been the #1 place that you've noticed the most improvements?
Everything, even softball.
Softball as well?
Yep.
Because you were also dealing with some right shoulder issues on that first visit when you came in. You said that's been doing a lot better since?
Yes, a lot.
Last one right here. Good. All right, quit torching you there for today. So next we're gonna get to these thoracics here. I'm gonna lower this table just a bit for me. Get a little bit more leverage here. So I'm gonna start right there at T10. I'm gonna have you take one more nice big breath for me so I can get the timing here. Good, one more big one here. All the way out, let those shoulders just kind of sink and drop for me. There we go, yes sir. You don't get a lot of the audible popping and clicking, but I know you felt that motion underneath there,
Yeah,
which is
I felt
exactly
it.
what we're trying to get. Nice, that one too. I told you we're gonna get, it may not be as noisy as you want, but again, we want the motion into those joints, not necessarily just the popping and clicking.
Yeah, I can actually feel it, so that's good.
Got a big breath for me. And all the way out, let those shoulders keep dropping, dropping, dropping. Good. Got one more here, can you handle her? All right, big breath. Good, all right. You feel the hip popping up next, okay?
All right.
You said not many chiropractors have ever been able to get much movement there, huh?
No.
So I told you we had some jackhammers in the back we'd break out to get that concrete loose for you. All right, have you go face up for me next.
All right.
So next I'll contact those cheeks on either side. Work on getting that head back up over your shoulders. So you said you were even hitting the ball a little further after the last adjustment, huh?
Yeah, it was different.
Yeah, have you go arms up to the side. This is where we're gonna work on that right shoulder and do a little bit more specific drops on that AC joint today. Got a little bit more muscle than my last patient, so I had to turn that up there. So for this one, it's the same exact AC adjustment that we always do for our patients, but I'm gonna do a little bit more specific unilateral contact here just to get some extra motion into this AC joint form. Big breath for me. Good, last one. Perfect. You feel that motion into that joint there too, huh? I'll switch it up. Same thing on this side. Last one here. Nice. All right, have you go back on arms to the side because we're still gonna do clavicles and anterior ribs. You get the full meal deal every single time you come in here, Frank. And unlike a lot of chiropractors, now that we've already got you to that position of being stabilized after your second visit here today, I'm gonna leave you as needed so that you can just call or text when you wanna come in for that tune-up adjustment.
So before big golf tournaments.
Yeah, absolutely. Well, I always like to tell patients too that I don't necessarily want pain to be the reason that you come in. If you start noticing some of the stiffness sensations or soreness sensations, or a lot of patients even report that they can feel that their walking and gait change when they start to get subluxated. So all those are signs to come back in for those follow-up treatments. Don't let it get back to square one that brought you in, all right? All right, big breath for me. Don't let that leg go here. Nice. I felt that one in the knee. Did you feel it all the way up into the hip and low back?
Oh, yes. I told you the last time, that's the first time that everybody's done that to me.
This adjustment here?
Mhm.
Yeah, probably the first time that hip's ever been adjusted too.
Yeah.
Nice. I didn't feel as much in the knee. Did you feel it up into the hip on that one?
A little bit into my back.
Okay. I'll have you slide up one more time. I'm gonna do double dinger on that leg today.
All right.
Have you slide up a little bit for me. I just don't want to pull you off the table.
Oh, no, that's fine.
That wouldn't be fun for either of us, did that? I don't want to be the source of your headaches. Nice. A little bit more there. Right, help you up here. And we'll swing those legs around and face Miss Shiloh next. So now that we've already worked on the AC joint, this is where I'm going to now work on the glenohumeral joint on both sides. I'm going to really push this one back here. I'm going to work on that range of motion for that right shoulder. Get a big breath for me. And all the way out. And look up at the ceiling for me. Nice. Good movement there today. Even more than last week, huh?
Oh, yeah, definitely.
That's the cool thing about this technique and about these procedures that we do in here, is that yes, the very first one usually is pretty intense. That's because a lot of these joints haven't moved like that in a long time. So after we get a couple of these adjustments done, it's not nearly as abrupt as that very first adjustment when you come in. And that's why we use the gym analogy so much. You look up one more time for me. There we go. Okay, I'm just gonna drop that shoulder there for me. Nice. Crack addicts are gonna love you, Frank. You're noisy all over. There we go.
I've never been that noisy before. I've never popped like this.
So you came to this office, huh?
Mm-hmm.
So you were such a crack addict, you decided to come to the licensed crack dealers finally, huh?
Finally.
You travel in for these visits, don't you? About an hour, hour and a half?
About an hour and a half.
Yeah. Would you say it's been worth the time and energy and money to come in and get adjusted here?
Definitely.
Awesome. Last one. Nice. All right, Frank, since you're in Houston, since you're in the Greens Point area, we got to shoot you now. Don't worry, it's just my grease gun, not my Glock. So, now if you bend that head forwards and backwards one more time for me. Good, then back to neutral. Good, on a swivel already. Yeah. We're still gonna help that out by loosening up these muscles and bouncing that atlas one more time. You've been keeping up with your homework I gave you last week too?
Yes.
Awesome. Because that homework is what's gonna help you get better quicker and stay better longer, because we don't want patients having to come in and see us all that often. We want to get you over that pain cycle that you're in and then teach you the things that are going to keep you out of our office. And then just using us as a resource along the way in case anything happens again, or if you need more information on exercises, stretches, nutrition, any of that kind of stuff. Good. Now, if you show me that homework, my shoulders up and back. Good. Chin straight back. Yes, sir. One more little tap here. Bend that head forwards and backwards one more time for me. Should feel like I put a little WD-40 in there, but you tell me.
It feels great, thanks.
Awesome. So Frank, again, thank you so much for sharing your story here with the crack addicts on YouTube. Is there anything, any final closing statements you'd like to make or anything you'd like to share with the audience out there?
If you're on the fence, come in and get adjusted. It's a life changer.
Appreciate that very, very much. I think you said your son might be wanting his first ring dinger soon too, huh?
Yeah, he was gonna ask me, he's 10, he's like, after I see that, can I get it done? I was like, we'll figure that out.
We'll leave a few more years for him.
Yeah.
We want him to get to about at least 17, 18 years
Yeah.
old before we give him his first ring dinger, but we'll make sure he sees this video and he looks forward to it here.
Sounds
in a few
good,
years,
I
huh?
appreciate it.
Yeah, absolutely,
Thank
Frank.
you.
You be safe traveling back home, all right, brother? So this is your Houston chiropractor, Dr. Tristan Wendt, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Frank traveling all the way in from
Caldwell, Texas.
Caldwell, Texas, and we'll see you guys soon.